Hi, I'm Dr. Alan Percy, a pediatric neurologist at the UAB Children's Rett Syndrome Clinic, recognized as a center of excellence by the International Rett Syndrome Foundation. Because Rett syndrome is a medically complex neurodevelopmental disorder that is associated with various comorbidities, it is important that each person with the condition receives comprehensive care that helps address their unique set of needs. If you go back to the basic science understanding of Rett syndrome, and that includes animal models, it is very clear that the neurons in the brain are present. There's no loss over time, but they're smaller, and they do not develop the amount and sophistication of connections with other neurons or other cells to develop into a normal child or individual. The idea of this, however, is contrasted with those who have a neurodegenerative disorder, where it is a progressive disorder with progressive loss of nerve cells and ultimately leading to death prematurely. I'm a neurologist, and our feeling has always been that if you're going to treat one of these disorders, the earlier the better. However, by the same token, we have seen improvements in older individuals, including adults, leading to the conclusion that younger age is not the only answer, and that all individuals with Rett syndrome deserve the opportunity to have access to this medication or any other medication that might come along in the future. Primary care physicians and other healthcare professionals, such as neurologists, physical therapists, occupational therapists, speech therapists, gastroenterologists, and neurodevelopmental specialists, all play an important role in helping monitor the long-term health and well-being of people with Rett syndrome. Caregivers also play a key role because they know their loved ones better than anyone else. I believe it is important for members of the patient's care team to address the symptoms of Rett syndrome along with various comorbidities associated with the condition. I'd look at the condition holistically to fully evaluate progress and determine appropriate management for each patient. Every time we see an individual with Rett syndrome in clinic, we ask, what have they accomplished with any member of their care team, whether it is a physical, occupational, or speech therapist, whether it is their primary care physician, or any other subspecialist. Many of the children we see come from fairly long distances. So if they have significant seizure disorder, epilepsy, they may get their care for the seizures from a local neurologist, and we assess how that neurologist is relating to the family and what their impression is of how the seizures are being managed. Same is true for gastroenterology, for orthopedic management, because orthopedics are very, very important for this disorder. One thing that has not been mentioned really is that some of these girls have significant behavioral issues, and some of them are incredibly anxious, and we use medications for that. Also, they have difficulties with sleep, and we use medications for that. Our view in terms of a multidisciplinary team is that the primary care physician should be the quarterback of the team and should communicate with all of the other members of the team as to how he sees things going, or if things are not going well, to make certain that the specific subspecialist is involved to address whatever questions may arise. For people living with Rett syndrome, DAYBUE has the potential to become a meaningful part of their multidisciplinary care. Rett syndrome is generally managed on a symptomatic basis. Watch Chapter 1 in this series, Understanding DAYBUE Clinical Trial Results, to learn about the potential benefits and tolerability profile of DAYBUE. When a person with Rett syndrome is not receiving care at a center of excellence, their caregiver can work with the patient's local healthcare professional to create a comprehensive care network to help support ongoing treatment and collaborative symptom tracking. I believe that it's important for prescribing healthcare professionals to proactively follow up with caregivers to monitor not only patient progress, but also potential side effects, including weight loss. Caregivers hold key detailed information about their loved one, and this can be useful in the management of Rett syndrome. As such, they can also play an essential role within the extended care team. Given the medically complex nature of Rett syndrome, with evolving comorbidities throughout life, coordination across multidisciplinary specialists is important. Evidence supports multidisciplinary interventions for people of all ages with Rett syndrome. All patients have the potential to benefit and deserve the opportunity to find out how various care options will affect their condition. I think that the principal outcome for us was relief. We finally had something that we could offer that might provide improvement. And by improvement, this is incremental improvement. This is not a cure by any means, but it provides incremental improvement that advances the ability of the child to interact, to behave in a more proper way. Our attitude or feeling was relief, first and foremost. But then it gave us the job of contacting as many people as we could and encouraging them to at least give this medication a try. Our experience is that in order for DAYBUE to work, it has to be taken probably lifelong or as long as possible. And we have to encourage families to stay the course with the medication and to tell us if they're having issues with which we could deal or help them get through this. But the main issue is staying the course. And this is a long-term treatment prospect. This is not a short-term and then done. Since DAYBUE is the first and only FDA-approved treatment for Rett syndrome, I believe that every patient and caregiver deserves the opportunity to try DAYBUE as part of their multidisciplinary care plan.
Indication: DAYBUE is indicated for the treatment of Rett syndrome in adults and pediatric patients 2 years of age and older. Important safety information, warnings and precautions. Diarrhea. In a 12-week study and in long-term studies, 85% of patients treated with DAYBUE experienced diarrhea. In those treated with DAYBUE, 49% either had persistent diarrhea or recurrence after resolution despite dose interruptions, reductions, or concomitant anti-diarrheal therapy. Diarrhea severity was mild or moderate in 96% of cases. In the 12-week study, anti-diarrheal medication was used in 51% of patients treated with DAYBUE. Advise patients to stop laxatives before starting DAYBUE. If diarrhea occurs, patients should notify their healthcare provider, consider starting anti-diarrheal treatment, and monitor hydration status and increase oral fluids if needed. Interrupt, reduce dose, or discontinue DAYBUE if severe diarrhea occurs or if dehydration is suspected. Vomiting. In a 12-week study, vomiting occurred in 29% of patients treated with DAYBUE and in 12% of patients who received placebo. Patients with Rett syndrome are at risk for aspiration and aspiration pneumonia. Aspiration and aspiration pneumonia have been reported following vomiting in patients being treated with DAYBUE. Interrupt, reduce dose, or discontinue DAYBUE if vomiting is severe or occurs despite medical management. Weight loss. In the 12-week study, 12% of patients treated with DAYBUE experienced weight loss of greater than 7% from baseline, compared to 4% of patients who received placebo. In long-term studies, 2.2% of patients discontinued treatment with DAYBUE due to weight loss. Monitor weight and interrupt, reduce dose, or discontinue DAYBUE if significant weight loss occurs. Adverse reactions. The common adverse reactions, greater than or equal to 5% for DAYBUE-treated patients, and at least 2% greater than in placebo, reported in the 12-week study were diarrhea, 82% versus 20%, vomiting, 29% versus 12%, fever, 9% versus 4%, seizure, 9% versus 6%, anxiety, 8% versus 1%, decreased appetite, 8% versus 2%, fatigue, 8% versus 2%, and nasopharyngitis, 5% versus 1%. Drug interactions. Effective DAYBUE DAYBUE on other drugs. DAYBUE is a weak CYP3A4 inhibitor. Therefore, plasma concentrations of CYP3A4 substrates may be increased if given concomitantly with DAYBUE. Closely monitor when DAYBUE is used in combination with orally administered CYP3A4 sensitive substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Plasma concentrations of OATP1B1 and OATP1B3 substrates may be increased if given concomitantly with DAYBUE. Avoid the concomitant use of DAYBUE with OATP1B1 and OATP1B3 substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Use in specific population. Renal impairment. DAYBUE is not recommended for patients with severe renal impairment. DAYBUE is available as an oral solution, 200 milligrams per milliliter. Please read the full prescribing information, also available at daybuehcp.com.